Hi, my name is Ashley Ball, ID number 336-3377. It is the 2019 spring semester for class number VTHT 1301-33422. And today I'll be demonstrating a nail trim on a dog. The supplies that you'll need will be your nail clippers. These are the scissor clippers, and these are the guillotines. And you'll also want to keep some quick stop available. This will help if you happen to hit the quick, and the quick is actually the blood supply to the blood portion of the nail. And on the clear nails, it's pretty easily seen. You can actually see the pink right there at the tip of the nail. And you want to try to avoid hitting that. If you do happen to get it, it can cause some pain and discomfort to the patient, and it will cause them to bleed, so you'll want to make sure that you keep that in order to help get it stopped. You want to try to keep their nails trimmed pretty regularly, usually every 4 to 6 weeks, and it will also help kind of keep their nails cut back. The longer they get, sometimes they can actually curl around and grow into the pad, or as they're running and playing, they can hang in the carpets, on furniture and blankets, and actually break and tear, and that can lead to a lot of pain and also can lead to infection, where they'll need to actually be placed on antibiotics. If you don't have quick stop, they also make some silver nitrate sticks, which kind of look like a little Q-tip with a black end. You'll want to be careful when using these because it can actually stain and leave some marks on furniture or on any other material, so be careful when you use those. It takes a while if it gets on your hands to come off. What we'll do is we'll just kind of gently pick up the paw, and you can see here her nails aren't too terribly long and the quick's pretty long, so we'll only be able to take the tips off today. So you'll gently just place the clippers in and squeeze. And it's easier to kind of work your way back. You don't want to take off too much and risk of hitting that quick, so just kind of take a small amount off at a time. If the nails are black, you'll often see kind of a little curve at the end of the nail, and especially in the black nails is when you'll definitely want to work your way back, and you'll see it kind of getting softer there at the ends. It'll kind of change a little bit of color and it'll get real soft, and that's when you'll want to stop so that you don't hit the quick. If you do happen to hit the quick, what you'll want to do is you'll just get your quick stop, dip the nail in there, and then kind of just apply a small amount of pressure, and that'll help get the bleeding stopped. If you do want to use the silver nitrate sticks, you'll just get the tip of it and then just gently rub it on the spot that is bleeding, and you'll notice it kind of turning it black, and it will stop the bleeding. Now, not all dogs will have a dew claw, which is the inside nail. Those tend to grow the longest because they're not getting worn down as they rub around or as they run around. So it's really important to check to make sure that they don't have any dew claws, and if they do, to make sure that we get those clipped as well. Okay? It's important that when you're done that you kind of go over all the nails to make sure nothing's bleeding, and you can also check to see if you can possibly go back a little bit further on any of them. And they look good. And today I'll be demonstrating a nail trim on a cat. This is Zeke, a neutered male. And the supplies that we'll need today are going to be your nail clippers. There are a couple different kinds. Here are the guillotine type, and then the scissors. And you'll also want to keep some quick stop available, which is this powder substance, which will help if you hit the quick. Now, the quick is kind of the blood component of the nail, and on some nails you can see it really well. You can actually see the pink right here, and if that is hit, the nail will actually bleed a little bit. It can cause some discomfort, so if you hit it, it's just a matter of trying to get it stopped and applying a small amount of pressure. It happens. If the quick stop isn't working, sometimes silver nitrate sticks are really handy to have around. It's just a small, it almost looks like a little Q-tip with a black end. Now, you want to be careful with the silver nitrate because it can stain if it gets rubbed on a surface of any sort, or on you, it'll stay there for a while. So I do prefer the quick stop. It's important that you keep their nails trimmed because as the cats run around, they tend to get them hung up in things. They'll get them hung up in carpet. Now, when you're trimming their nails, you may want to keep a towel around too to kind of help keep them restrained. What you'll want to do is you'll kind of wrap them up like a burrito. You'll just take the towel and kind of gently wrap them like this, and then you can just gently pull the foot out that you're needing to extract the toes, okay? All right, so what you want to do is you'll kind of just gently pick up the paw, and to get the toenail extracted, you'll kind of feel the pad at the base of the foot, and then on top of the foot, you'll just kind of gently press down, and that actually extracts the toenail. I'll be using the guillotines on his toes today in front of that pink so that you don't make them bleed. So what we'll do, you're okay, is just gently push it down, stick it in there, and then just stick it in there and cut. Same thing with the rest of them. You'll find the pad at the bottom and cut them. Gently work your way back. Now on the black. If for some reason you do happen to hit the quick, don't panic. What you'll do is you'll just gently extract the claw, dip it in the quick stop, and just kind of gently hold a small amount of pressure and get the quick stop applied, and it will usually help quit the bleeding. If you need to use the silver nitrate stick, you'll just samples out and then just gently rub it over the spot that is bleeding. And that's it. Hi, today I'll be demonstrating how to pill a dog. The supplies that you're going to need are the medications that are going to need to be administered, and it helps to have a small syringe with a little bit of water so that you can help induce swallowing if needed. The smaller dogs you may want to set up on the table so that you can kind of tuck them under your arm and keep control with your hands. A larger dog, it might help to have them sitting down kind of in between your legs so that you can kind of stay behind them so that they can't scoot backwards and get away from you. And then it'll be kind of important to kind of keep their heads up so that you can insert the pill down the back. So what I like to do is usually start, I'm right-handed, so I'll usually put the medicine in my right hand, and I'll try to keep the capsule or pill, whatever it is, in between my thumb and my middle finger so I can use my pointer to actually, when I drop it, to actually kind of force it back down to the throat so it'll swallow. And then I'll use my ring finger to actually apply a small amount of pressure to that bottom jaw so that it kind of gets their mouth open. So this is Logan, and what we'll do is you want to kind of, like I said, pick their head up just a little bit, and they have some longer teeth in the front called canines, and I'll use their jowls, so hopefully if they do happen to bite down, it's not on your fingers. So you'll just want to apply a small amount of pressure on those canines and lift up, picking up that upper jaw, and like I said, using that lower finger to put pressure on the bottom jaw. So we'll gently just pick up, put a small pressure down, kind of drop the pill, and then put it down the back of the throat. Now you want to gently massage, and if you notice that she's licking, and you can actually sometimes feel them swallow. If they get to gapping and chewing their mouths open really hard, most of the time they've actually gotten the pill up, and they're gonna crunch on it and spit it up and make a big mess. If you're worried that they haven't given the pill, you'll want to just give them a small amount of liquid in the corner of their mouth and gently massage again, and you'll notice that she swallowed yet again. Once you're sure that they have swallowed, you know you've got their medication in them. Hi, today I'll be demonstrating how to pill your cat. The supplies that will be needed for today are going to be a towel to kind of help keep them restrained and wrap around them if they do kind of become a little bit aggressive and are trying to get away from you. You'll want the medication that's going to need to be administered, and it'll help to have a little bit of water in a syringe so that you can give it to them orally and help induce swallowing if necessary. If you need to wrap up your cat in the towel, what you'll do is just kind of gently lay him down in it and almost wrap him up like a burrito. You're going to want to make sure those front legs are covered and the back ones are tucked up underneath them, and then just gently kind of wrap the towel around. Now, if you aren't using the towel, you'll want to make sure that you kind of keep their rear end tucked up, kind of up into your armpit a little bit. Now, when given the medication, what you'll want to do is kind of place the pill in between, what I like to do is in between my middle and my thumb, so that I can use my ring finger to kind of gently apply pressure, and then I'll insert the pill and then use my pointer finger to actually help induce getting it down the back of the throat. Now I'll use my other hand to gently put some pressure a little bit on the back of the head to kind of keep the head pushed forward. That way he can't pull it back. And what I want to do is, after I kind of get my hand back here, is I want to use my middle and my thumb to put a little bit of pressure on the upper jaw. I usually like to grab a little bit behind the canines. So I'll put just a small amount of pressure. He'll open, use that, and then gently push it in. Now you'll want to make sure they swallow, so I try to hold their mouth up and gently massage their throat. And if you don't think they swallowed, you can blow a little bit, and like I said, just kind of gently massage. And normally you'll see them licking, and you can sometimes feel them actually swallow the medication. If you feel that you did not notice them swallowing or licking enough, you can just gently insert a little bit of water in the corner of their mouth. Just squeeze a little bit in there and gently massage until they swallow. And that is how you get your medication in your cat. And today I'll be demonstrating the urine collection on a female dog. This is Scarlett. She's a 3-year-old female spayed Catahoula mix. Now the supplies that you'll need for the collection are going to be a sample cup. Just a small cup with a handle works great, or a ladle is also a really good tool to have, and even just a small plastic container. And you'll also want to have a leash so that you can kind of keep the animal close and contained to you, so that you're not having to run amongst the yard trying to chase down and get them to collect the urine. When collecting a urine sample, it's important that you try to get a midstream collection, meaning you don't want the very beginning of the collection and you don't want the end of the collection. The beginning and the end of the collection tend to hold more bacteria and contaminants in them, so you want to let them urinate a small amount and then insert the cup or whatever you're using to get the sample, collect some, and then extract, pull it out slightly so that they can finish their urine. We'll go ahead and step out here. We'll kind of follow her around with the urine out here and get our sample. And now you'll have your urine ready for your urinalysis. And today I'll be demonstrating applying a gauze muzzle. The supplies that you'll need for a gauze muzzle is you'll need some rolled gauze. 1 to 2 inches is usually pretty good, kind of depending on the size of the dog. Smaller dogs, you'll probably want the 1 inch. Larger dogs, you'll probably need the 2 inch. You'll want to make sure that you don't apply the muzzle too tightly, especially with a gauze muzzle, because it kind of can start cutting off some circulation and causing a lot of discomfort, making them want to fight a little bit more. But you want to make sure that you don't have it too loose either, so that they can't open their mouth and actually bite you while they're still being muzzled. So what you want to do is you'll want to kind of cut a longer strip, like I said, depending on the size of the dog. Honestly, the longer the better. That way you ensure that you have plenty to get wrapped around and get tied off. With the loop already in place, so you can slide it over and then get it tied off. And the same thing, you're going to want to come around, and you want to make sure that it's pretty snug. Like I said, you don't want to just get Superman tight with it and get too aggressive. You're going to cross them at the bottom, and same thing, come behind, and then you're going to want to tie it off. You'll want to make sure that you keep it to where it's readily available to get pulled off in case an emergency situation happens, that they kind of start losing color in their gums or they're starting to have difficulty breathing. You want to be able to pull it and then just get it and be able to get it off quick. And that is how you can get a gauze muzzle applied.